Welcome to Number 1 Doctor Channel. Today, we will talk about Zenker's diverticulum. Caused by increased pressure during swallowing. Is a false diverticulum located posteriorly. Occurs between the pharyngeal constrictors and cricopharyngeus. Caused by failure of the cricopharyngeus to relax. Symptoms: upper esophageal dysphagia, choking, halitosis. Diagnosis: barium swallow studies, manometry, risk for perforation with upper endoscopy, and Zenker's treatment. Cricopharyngeal myotomy. Zenker's itself can either be resected or suspended. Removal of diverticula is not necessary. Left cervical incision, leave drains in, esophagogram postoperative day 1. Thanks for watching. Hope to see you again in more next videos. Please subscribe to our YouTube channel, Number 1 Doctor Channel. Like and share our videos. With my best wishes, and best wishes of Dr. Atef Ahmed.